Okay, so this is our second conversation in our maternal mental health series, where we are talking to leading thinkers about maternal and perinatal mental health. We hope that this series and the conversations that stem from the series become a useful resource and tool for anyone from parents to policymakers who want to know more about maternal mental health and what we can do to support mothers and families, ensuring a better and healthier society for all of us. So today at MMM, we are absolutely honored and delighted to have Dr. Alain Gregoire join us to talk about his work in perinatal mental health. Dr. Alain is a consultant perinatal psychiatrist who chairs the Maternal Mental Health Alliance, which is a UK-based charity with a network of over 120 organizations, which is dedicated to ensuring all women and families impacted by perinatal mental health problems have access to high quality and compassionate care and support. This is a growing alliance with ties to the Global Alliance for Maternal Mental Health, which is a worldwide coalition of organizations committed to improving the mental health and well-being of mothers and children across the world during pregnancy and in the first postnatal years. So thank you, Alain. Thank you so much for joining us today.
It's a great pleasure, and thank you for having me, Ingrid. And it's wonderful to work alongside Make Mothers Matter, such a fantastic organization that is, of course, itself recently a member of the Global Alliance.
Perfect. So if we could please start by you telling us the story of how maternal and perinatal mental health came to be so important to you.
Yes, I first started my postgraduate medical training in obstetrics, planning to be an obstetrician and gynecologist. And what I found during the early time of that training was that the women who were the most ill, the most unwell, and the least well supported and understood by health services here in the UK were women with mental health rather than physical health problems. And at that time, in fact, the whole the terminology around perinatal mental health, the term itself didn't exist. But I decided to switch from obstetric training to psychiatry training in order to focus really on the needs of this group of what had been patients of mine who'd received such terrible care. And I've been unbelievably fortunate in my career in being around at a time when there's been a huge growth in understanding through research around perinatal mental health, but also, particularly in the UK, in development of services dedicated to the care of women during pregnancy and postnatally, their mental health, and linked to that, of course, their relationship with their baby, or fetus, and family relationships around that time, which are also profoundly affected, not just by that extraordinary transition of having a baby, be it the first or subsequent, but also the mental health turmoil that so often happens around that time and has been, until really recently, unacknowledged, with women suffering in silence. And that is starting to change, but maybe we'll talk more about that.